Thank you very much for joining us once again. I'm Dr. Derek De Silva as we continue our informative series, which is what I like to call it. Let's talk about the 7 best anti-aging ingredients. Very important, folks. Very important. We're all in a lot of us, some of you may not be, in our 50s. I am in my late 50s, actually. And the whole aging phenomenon becomes a very important piece to us. So what are some of the best anti-aging ingredients, the 7 best? And by the way, this is from a writer by the name of Grace Gold. B vitamins. B vitamins are so critical. B vitamins are so important for energy supplementation. Vitamin B6, B12, folic acid, very important to reduce homocysteine. Homocysteine is an amino acid that destroys the inside of blood vessels and will increase your risk for heart disease. So B vitamins, extremely important. B vitamins, by the way, are very important for your skin, your hair, and your nails. This is from a dermatologist by the name of Dr. Joel Schlesinger. He's from Omaha, Nebraska. That's a quote that is in this article. So the importance of B vitamins, again, as we age, real important. Coenzyme Q10. Coenzyme Q10 I have talked about many times in my lectures. It's probably one of the first vitamin supplements that I started talking about 25 years ago. Coenzyme Q10 is a cellular energy nutrient. It is the spark that lights the spark plug that fires the engine. Every single cell in our body contains coenzyme Q10. You can fit 10,000 human cells on a pinhead. So you can imagine how many cells are in our body. The number is, in my mind, is almost infinite. The number in my mind is infinity. So coenzyme Q10 is in every single one of these cells. And as we get older, the levels of coenzyme Q10 really start to plummet. And then you start using prescription medications, which makes those levels plummet even more. The cholesterol-lowering medications, the antidepressants, some of the heart medications, and some of the blood pressure medications. All of those will take coenzyme Q10 out of your body. Therefore, supplementation with 75 to 100 milligrams of coenzyme Q10, really important for you. The next, copper. A lot of people don't pay a lot of attention to copper, but copper is really important for collagen and collagen formation within the skin. It is a really important agent. And clinical studies, I want to read this for you, have shown that copper contributes to the cleaning and renewal of fractured collagen, making it an excellent ingredient for those who wish to improve the look of sun-damaged skin and scars. But copper has to be taken and it has to be balanced. You just don't want to start using high doses of copper. You have to be careful with how much you use. Always follow the directions on the bottle when you're using something like copper. Green tea. Green tea has all kinds of polyphenols and all kinds of phytochemicals. EGCG, L-theanine. These are all really, really nice ingredients, or nutrients, excuse me, as far as anti-aging nutrients when it comes to green tea. Those are the 2 principal ones in there. Peptides. Peptides, there's a lot of, or basically what peptides are they're short-chain amino acids. They're the building blocks for the protein. I haven't talked a lot about peptides in the past. What I am going to tell you is that the next generation of anti-aging medicine are going to start concentrating and focusing on amino acids and peptides. I've gotten very interested in this whole world of amino acids and peptides. I personally have been using a really good amino acid complex that I feel has really contributed to my energy, my vitality, and just the whole aging phenomenon as we go through this, especially in our 40s, 50s, 60s, and into our 70s and 80s. So amino acids are going to be the next generation. Remember also that arginine, citrulline, and ornithine are the amino acids that stimulate the pituitary gland to make growth hormone. And a lot of people today, and in fact I'm working with a doctor down in Florida that is using amino acids intravenously and also as an injectable to stimulate the pituitary gland to make growth hormone. These are very safe. There's really no danger to them at all, but using it orally is a great way to start. Very safe, very effective, and really good for you. Next, we get into some vitamin E. Very important when you take vitamin E that you use a complex of vitamin E. Vitamin E comes in 8 different forms, the tocopherols and the tocotrienols. All 8 forms of vitamin E need to be in there to work as an anti-inflammatory and as an antioxidant. And last but not least are the retinols. These are over-the-counter agents that can be used on your skin. Again, you don't want to overuse them. You make sure you talk to a dermatologist that is knowledgeable or an esthetician that's knowledgeable if you're going to use that. So all of those really important. A quick review: the B vitamins, coenzyme Q10, copper, green tea, peptides, retinol, and also vitamin E. I thank you so much for joining us.